Ankle injuries happen frequently. It happens in basketball, happens in tennis, happens in so many sports. And it can be quite a devastating injury. But there are quite a few things that you can do to prevent yourself from actually developing or getting that injury. If either the hamstring's off or there's an imbalance between the quads and the hamstrings, it's setting the stage for some sort of injury. Probably one of the most common injuries that occurs within female athletes, an ACL tear, ACL sprain, or an ACL tear. The muscles themselves are not stabilizing the knee properly, and then it allows for the strain to all be placed on that ACL. Nutrition, because it's actually a really big part of a lot of these dysfunctions and the reason these occur. I like to have higher amounts of vitamin C, higher amounts of collagen, a good source of protein or amino acids. I really like to utilize amino acids. All of these things, especially after your workout, are necessary because your muscles are just craving them at that time. And it's the repair. It's all of the tools, you could say, and the nutrients that are necessary for the repair of the muscles and tendons.
If you've suffered pain in your shoulder, your knee, your ankle, your back, we're going to go through the top 5 sports-related injuries in the podcast today and what to do to make them better.
Absolutely. What a great day, and what a great time to talk about sports-related injuries as we're headed into spring and all the kids are getting out on the fields again. We're seeing lacrosse, we're seeing baseball, we're seeing soccer. Everyone's just itching to get out onto the field. So let's figure out how we can prevent these injuries and what we may need to do if we happen to get one of them.
You're Dr. Ron Dummar. I'm Nick, the co-host of the Be Well Now podcast. And you don't have to be a high school athlete in the prime of their genetic potential. I often think of what I could have been had I not been injured so many times. You could be in your 60s, hitting the gym a couple times a week, right?
Weekend warrior.
ACL, ankle, back, rotator cuff. What did I miss? Ankle? What are the top 5 injuries?
ACL, we have ankle, ACL, hamstring, low back, and rotator cuff.
You're a chiropractic physician, among many other things. You wear many hats here at Community Health and Wellness in Heber City, Utah. If you're interested, by the way, his clinic's information is down below. What are the most common injuries of this top 5, and where do we start in terms of like your sort of holistic health approach?
Yeah, so I would say let's start with the ankle. We'll start at the bottom, we'll work our way up. And, ankle injuries happen frequently. Obviously, we stand on, we use the ankle joint all day long, but the most frequent mechanism or way that we sprain or injure the ankle is by inverting or twisting that, rolling that foot underneath you. Okay. That's the most common way. It happens in basketball, happens in tennis, happens in so many sports. And it can be quite a devastating injury as well. But there are quite a few things that you can do to prevent yourself from actually developing or getting that injury. One of the reasons athletes get it is because of poor stability muscle, like stabilizing muscles within the ankle. So what are some things that we can do to improve the stabilization of the muscles of the ankle? You can put yourself or practice in a safe environment walking over uneven surfaces. So if you happen to love going to the beach or being outside, you can even walking on the sand or playing in the sand can be a way of training your body to walk on uneven surfaces and for the joints themselves to be practicing that stabilization. In the clinic, what we use are things like a ball, like a half Swiss ball, like a Bosu ball is what it's called. And you stand on it and it's an uneven, unreliable surface, you could say. And then we'll, challenge you a little bit as well. If we're working specifically to strengthen those muscles, we'll have you catch something and then throw it over there, or we'll perturb you a little bit and see if you can maintain your stability and your balance. But the important thing is making sure that those muscles are stabilizing that joint properly, so that when you are looking away in a sport, whether it's basketball and you've got to keep your foot within bounds and yet still throw the ball and look at where you're headed and not at your foot, you need to be able to place it down with the most athletic adeptness possible. And what happens is we just get a little bit like our understanding, we call it proprioception, of where our joints are in space gets a little bit off because we are either experiencing repeated strain or overuse to the muscles or tendons of the joint. And then we place it down just a little bit wrong, and boop, we roll it, we sprain it.
A friend of mine who's a physical therapist said she wished that after people sprain their ankles, they would go see someone like her, because often after a sprained ankle, things can get a little wonky.
Yes.
I don't know how she explained it, but what would you advise someone who's just like, oh, it's just a sprained ankle, I just need to ice it, maybe it'll take a couple of weeks to improve and I'm good? Because she was saying something happened with me after a sprained ankle a few years ago, and I never sprained my ankle. First time it happened was at 35, and she said that messed some things up in there.
Yeah, for sure. So one of the things that will happen, and you'll actually hear people say this frequently, is that, well, that's my bad ankle. And then they live just with a bad ankle for the rest of their life. You know, it seems like, well, that's my bad knee, that's my bad ankle. It's like, well, let's see if we can turn that into a strong ankle and a strong knee. And the way to do that really is identifying, okay, where are the dysfunctions in the movement of the ankle, right? So do we have strength through the entire range of motion? Or is there enough flexibility, or do we have hypertonicity in some of the muscles? And oftentimes you'll find certain groups, there may be a group of muscles that are super tight and another group of muscles that are super relaxed and flexible. And you need to create that balance of tonicity. So you need to work them both out. Same thing when we talk about the hamstring, it's the same thing. Oftentimes hamstring injuries, I know we kind of jumped from ankle to hamstring, but hamstring injuries are often from like a ballistic, quick force action that takes place. But frequently it's because either the hamstring or the quad, one is worked out more than the other, right? So basically it's an imbalance of strength. And so when you do work out hamstrings, some people are like, well, I'm just going to do squats, or I'm just going to do, work my hamstrings all day long. It's like, well, you also need to be working your quads. You need to be working your hip flexors. You can't have hip flexors be super, super tight and then your hamstrings and your pelvis be off. And if you look at the structure where you have an imbalance, if either the hamstring's off or there's an imbalance between the quads and the hamstrings, it's setting the stage for some sort of injury. Oftentimes in the clinic right now too, when it comes to hamstring, glute, thigh injuries, we're seeing a lot of actually anterior, which is hip flexor injury. So the hip flexor gets super short, especially because a lot of people will sit. So this happens maybe more so even in your weekend warriors or your older aging populations where they have the opportunity to work out and then literally sit down for longer hours of the day. Some people, I guess this could be even those who work at a desk or behind a computer, where they'll have a workout, they'll get the blood pumping, get the blood moving, and then they'll sit for long periods of time. That actually puts the psoas muscle, the hip flexor, in a shortened position. So it teaches it almost to be really short and tight. So then when you go to stand up, you feel, like it's tight in your back, in your hip, because the muscle's pulling so much on the pelvis, and then the pelvis, the hip structure pulls on the low back, and those muscles, you feel like you have to just stretch them out just to stand up and walk. So that can lead itself to increase hamstring injury and even low back related injuries. Now, I jumped right over the knee.
Okay.
So we should talk about the knee because this is really important too when it comes to, especially in sports, a lot of female athletes. Probably one of the most common injuries that occurs within female athletes is an ACL tear, ACL sprain, or an ACL tear. And it really comes from, again, an imbalance in the structure or the muscles, so that the muscles themselves are not stabilizing the knee properly, and then it allows for the strain to all be placed on that ACL. And we get it into hyperextension. And then they just plant their foot wrong, and then whoop, you see all of the loading of their weight planting on that foot goes into that ACL, and then it causes either a tear or a sprain.
Well, I think we jumped from one to the other, and we didn't talk about prevention. We didn't talk about like nutritional support for that, because that's where I think you come in, where it's not just like just treating the symptom, you're often a treat the cause, systems biology guy. So there has to be more. I often wonder, like, what's causing the inflammation? Is what's happening in my body just this, or is there a root cause of the inflammation that might bring it down a little bit, if not, No,
that's a really good point.
Am I on the right track?
I absolutely wanted to talk about nutrition because it's actually a really big part of a lot of these dysfunctions and the reason these occur. We can repair a lot easier. We have tissue repair mechanisms that take place every time we perform an activity or a high intensity sport, whether it's in the gym or in our sport. We do have muscle tearing that takes place, and that is a repair mechanism that your body initiates from inflammation. Literally, the immune system creates a series of inflammatory chemicals to send it out to initiate the healing process. So every time we do this, that's why we experience a little soreness or a little achiness after a high intensity type of training routine. So we need to provide the body with the necessary nutrients, minerals that are going to provide us all of the repair mechanisms that we need. Sometimes I like to have higher amounts of vitamin C, higher amounts of collagen, a good source of protein, or amino acids. I really like to utilize amino acids. All of these things, especially after your workout, are necessary because your muscles are just craving them at that time. And it's the repair. It's all of the tools, you could say, and the nutrients that are necessary for the repair of the muscles and tendons. So yeah, if you're eating pizza and donuts and cookies, cakes, candies, the typical standard American diet, all of those nutrient depleted foods, your body is going to be starving for those nutrients, and it is going to perpetuate injury down the road.
So what do we do if we get these injuries?
So as far as nutrition, number one thing is you want to be creating an atmosphere within the body that's going to promote the healing and tissue regeneration. So collagen, we need collagen. So we need vitamin C, higher amounts of vitamin C because it initiates the production of collagen. We can take collagen supplements. People will do that as well. Consume higher amounts of meat if you're a meat eater, or even utilizing amino acid supplements. Branched chain amino acids are a really good thing as well. But amino acids are the basic building blocks for proteins. Proteins was required to build muscle and repair tendon. There's also peptides that are made in your body. Peptides are created endogenously, which means inside your body, within the cells of your body, and they give instructions to the body to repair tissue and heal. And if we don't have the necessary nutrients, if we don't have the necessary amino acids to produce those small chain amino acids called peptides, we're not going to be able to properly repair and heal. So high doses of vitamin C, also really good quality fats. You're looking for avocado oil, olive oil, coconut oil, ghee, tallow, and just throw out the crap. Throw out the garbage food if you can, and think you're healing. You're in a recovery phase. You're healing. You want to repair as quickly as possible and get back to activity. That's what we want to do. And so we need to be consuming anti-inflammatory foods and anti-inflammatory fats. Anti-inflammatory fats like olive oil, coconut oil, tallow, ghee. Those are the most anti-inflammatory fats that you can consume.
So what are rehab strategies? I know we went from 1, 2, and 3.
So we talked about like the ankle.
Yeah, let's talk about the ankle, the knee, and the hamstring.
Yes.
Let's talk about the lower body stuff.
With regards to the knee and the ACL, you really want to be strengthening again that complex, the thigh and the leg, the muscles that stabilize the knee itself. So you want to be on a good rehabilitation program, and you want to be providing enough attention to the posterior elements and the anterior, or the quads and the hamstrings as much as possible when you're rehabbing. So we want that joint to be as stable as possible. Also, again, we're looking for how much can we challenge you stability wise? Okay, how much can we challenge you as we're retraining and strengthening that knee or that ankle so that you can stand on one leg and, look around and do other tasks, because that's literally what sports requires. Athletics requires you to not look at your feet, but place them in specific areas, right? And then do other things that are very demanding. And so we have to be able to challenge you in a rehabilitation sense to replicate that in a safe environment. So that's really what we're doing. But also on top of that, before, I would say, in the earlier stages of the injury, what we need to do is be realigning the muscle fibers, the tendon fibers. So as we have all of this inflammation, the body's trying to create a cast. That's literally what it's doing. That's why the swelling comes out. It's trying to restrict you from moving too much, because if you move too much, you could continue to just irritate and strain that muscle or tendon, okay? So the body's like saying, hey, let's slow down here. Let's be as modest as we can in our movement. That's in the early stage. But during that phase, as we move out of that phase and come into what we call more of the subacute phase, you have that kind of fastening fibrin that's laid down, and it feels really tight and restricted. We've got to break through that. And so we use a variety of tools like scraping, or gua sha is what we call it, gua sha literally. And we've talked about this on another podcast, but literally it's like sand water. It's like you're smoothing the sandy parts out, or the gristly parts out, where you've had that inflammatory mechanism take place. And there's you could say almost like scar tissue or adhesion type tissue in there. So we're smoothing that out, breaking it up, realigning it with the fibers of the muscles and the tendons. And then the body, the person feels way more flexible, almost literally immediately right after that treatment. So cupping, scraping, gua sha, ultrasound, electric stimulation, ice and heat, infrared therapy. We use acupuncture a lot to help stimulate collagen production, because it stimulates microcirculation, acupuncture does. It doesn't just work on nerves and neurology. It also stimulates local blood flow. There's oftentimes a little redness around the area where the needle goes in, and that is a sign that we're increasing blood flow and circulation. And so by doing these various treatments and bringing blood flow and nutrients into the area, hoping that we're consuming a good diet of vitamin C, vitamin E, good quality fats and oils, getting as many nutrients in there as possible. Then when we stimulate that area to initiate a response in there to signal to the immune system and to the body, hey, this area needs more blood flow, it needs more healing, more tissue repair, then we're going to have a surge and a rush of that fluid, and then we're going to repair way quicker that way. So we speed the healing process. That's our objective as chiropractic, functional medicine, Chinese medicine. We work to speed the healing process so that we can get back to our activities way faster than we otherwise would.
Sometimes it can get discouraging, though, that you feel like your body just isn't healing, and you forget that it's this magical, divine, self-healing mechanism.
Yes.
That can be a tough spot to be in.
Yeah, it is really, really tough. And sometimes that can be like a chronic infection that you're dealing with. It also can be an autoimmune condition that we see in patients sometimes, and we work them through those processes. Patients will express however their DNA currently is suggesting or telling their body to express. That is more of like an epigenetic type of concept, where what really happens is in your body at the cellular level, you have something happen in your body, or you have something happen in the external environment that affects your body, and then our DNA at the cellular level has to give us instructions on how to respond to that. So really, that's what's telling each individual how to respond to their environment, how to heal after an injury. So it's so important that we care for that DNA, that cellular level, even at the mitochondria level, because the mitochondria itself within the cell produces our energy source. And if we don't have the energy that's necessary for the cell, then we can't have the energy that's needed to repair. And so even if we're getting certain nutrients, even if we're doing all the right rehabilitation activities, we may not still have the proper mechanism happening within the mitochondria to initiate the production of energy to activate the cell to speed the healing process. And so, yeah, if there's some sort of cellular dysfunction, if there's some sort of methylation defect that the patient has, or a DNA disruption, we can look at that and say, okay, we need to make sure that you're getting X or you're getting more methyl factors to support that process. And once we support that process, then the lights turn back on, the mitochondria starts functioning again, ATP is produced, energy is revved up, and the cell starts producing and tissue heals.
So how do I know if any of that's going on? Is there anywhere I could go to get treated?
The first way you would know is you have a chronic condition that's not healing, right? You're like, wow, I just keep injuring this or I keep re-injuring this and it doesn't seem to really be responding or healing and I must need to do something more, right? That's the first indicator is, am I actually repairing? Do I experience a repair mechanism happening here, or am I just chronically in pain? Okay. So once that's happened, then we say, okay, well, why are you chronically in pain? Is it a chronic infection? Is there some sort of low-grade underlying inflammatory process occurring? Is there autoimmunity occurring? Or is this actually at the cellular level where the mitochondria has become dysfunctional as a result of some sort of physiological, pathological process? And so, yes, you can call our number, you can reach out to us, and we'll walk you through that process and help you to understand what is most important in your condition, for your body, for your physiology, so that we can make it unique to you. We don't have a McDonald's one size fits all approach. We prefer to have everyone have their own therapeutic treatment based on their own unique physiology.
All right, so rotator cuff. What else we got?
Yeah, rotator cuff is it's like the shoulder. So
rotator cuff and low back. I feel like those are the ones that I struggle with.
A lot of people struggle with them. Rotator cuff, the injury often happens from just a lot of overhead use. I've had patients that were HVAC. They worked in HVAC, and because they did commercial HVAC, they had their hands over their heads a lot. And just over the time and over the years, this is more degenerative. So it can be a degenerative process that causes injury to the rotator cuff. It can be a blunt trauma or force. It can be repeated overuse, like imagine like a volleyball player, right? Where they're constantly using more overhead type of actions in their sport or in an activity. Or it can literally be from a fall. Oftentimes I had a patient not too long ago who it was from water skiing, and they were doing slalom, and I know that's kind of an old art form now, but some of these patients, they really love putting a single ski on, right, and getting that slalom out there, water skiing, and then he fell. But also with slalom, you're at a high speed. It's not a slow sport on the water. Like surfing now, it's a very low speed. And, if you fall, it's more like there's very little impact there. I would actually recommend if somebody's going to do a water sport as they're aging, that's probably the one to do, is to pick up surfing. Besides, it's pretty cool, and all the younger kids will really like it now. So I guess if you pick up surfing. But slalom is it's a high speed sport, and you have to really pay attention to that speed. And as he was coming around, essentially he fell and hit the water funky and landed right on his shoulder, and he ended up tearing his rotator cuff. So we worked with that for a while, and so the rotator cuff will heal. The rotator cuff will heal on its own if you let it. You have to immobilize it for a while, and then you have to make sure that the muscles are strong and intact to support that joint. And then what you want to do is prevent the joint from excess motion, because if it's floppy and if the humerus is held very loosely within that labrum, then what can happen is the excess motion can lead to perpetual and increased degeneration. So you degenerate that joint sooner. This is why oftentimes people will elect for surgery. More often than not, surgery, they go in and they'll repair it or they'll sew it up, and that will help you to get there back to like a sport or something like that faster. But also what I say the benefit usually that people get is not necessarily that it's a faster recovery, but that once you've had surgery, then you know, okay, I have to lay low. Whereas if you haven't had surgery, you kind of think, oh, it's feeling all right today, and I'll just go use it. But you don't give yourself an opportunity to really immobilize it. Whereas when you have surgery, it's like, boom, you're immobilized. You're in a sling for a long period of time, and you're really following those doctor's orders, and you literally have an incision in your arm that motivates you to lay low. So I think that's one of the benefits, I would say, of a surgical intervention, is that it literally mentally gives you the game plan and forces you to have that immobility and allow it to heal. Because with the labrum, that's a lot of what it requires, is just time where it's not being strained. Because if you have this, you could say this tissue, and it's cut, and you just keep straining it or pulling on it with your movement, and you're spreading it out, right? But it needs to be here in order for it to heal. And it's like any sort of wound or incision. If you just kept pulling it apart with your movement, it would take longer to heal. And when it did heal, it might heal with, scar tissue or something in it. Okay. So how do we prevent that?
That's a good question.
How do we prevent those injuries from happening? Well, just like the knee and just like the ankle, we have dysfunctional movement patterns, or you'll have one group of muscles will be super strong and built up, and then the other will be super weak. That happens in your shoulder as well, based on just your regular movements throughout the day. Oftentimes, patients will come in with a dysfunctional orientation of their joint. You have to think of the shoulder a lot like a pulley system. If you have a pulley, you have a wheel, and then you have a rope that goes up over the wheel. And then you can lift a lot, and you can load a lot with that pulley system, and you're pulling on the rope, as long as that rope and wheel are intact and functioning properly. But if you take that wheel and you rotate it 15 degrees or even 5 degrees, and then you pull on that rope, what's happening is you start fraying that rope, right? And you can see how it will start to come slightly off to the edge. So that alignment issue in your shoulder, and the same thing applies, same principle applies to the knee and to the ankle. But that alignment issue immediately increases the loading factor by at least 10 times to the tendon. So now you're trying to lift that jug of milk out of the fridge, and you're like, whoa, why is that so hard? Why is that so hard? It's never bothered me before. And that is the importance of alignment. So we really have to get in there. We have to make sure that the scapula and the humerus are aligned properly. Because what happens with the shoulder joint, you have the scapula that sits along the ribs on their back, and it comes around and provides what we call a labrum, or a glenoid labrum area. So this is where the humerus, the head of the humerus, will fit right into there. And it's very open, and that's why we have a labrum in the shoulder. It's very open, the glenoid. It's like that, right? It's not really enclosed. It doesn't, like with bone, encapsulate that. It's all with that ligamentous tissue. So it holds it fairly loosely here, and then the ligament wraps it around and keeps it intact. So if that scapula slides around forward, if it rolls forward, and this is what happens to a lot of people, it'll roll forward, they'll be working with all their forward type movements, driving, which is shoulders rolled forward. They'll be doing, working at the computer or the mouse, which drives that shoulder forward for long periods of time. Pretty soon their shoulders they get held in the forward position, which is like that wheel being tilted out of orientation. And then they start lifting, or they go to the gym and they're working out, and they think they're doing good for themselves, and they're actually not, because they haven't addressed the dysfunction of the posture itself. So you have to address posture. That's one of the biggest ways to prevent these injuries, is make sure that joint is tucked back. Make sure the scapula is set properly. Make sure that when you're loading your shoulders at any time that you tuck those scapula back and down and engage those muscles properly so that we're not putting all the strain on the tendons of the rotator cuff.
Can chiropractic help with that?
100%. The alignment is the key. With chiropractic medicine, we're looking at the alignment of the scapula, which I adjust scapulas all the time, and also the shoulder itself.
And we have one more, which should be its own podcast, but we'll make it the fifth. Probably the most common injury that I would imagine you get is people saying my low back hurts.
We get a lot of low back pain. We get a lot of back pain in general, disc-related pain. We have sprains and strains in the low back. We have gluteal strains. You'll have piriformis syndrome. I mean, there's all sorts of issues that can happen in the back. There's
miserable too.
There's 6 layers deep of muscles in the back, and you imagine you irritate one layer, and then you have to identify, okay, which layer are we dealing with, and what sophisticated movement does that muscle perform, and how can we rehab that properly? There are a number of things that we can do in the short term. We actually like to do ozone injections can help with decreasing the inflammation, speeding tissue and healing recovery, tissue recovery. And also we can sometimes we'll utilize peptides. People are really big into peptides right now. But there are some.
Those can help with lower back?
Yes, there are some really beneficial ones to help speed tissue healing and recovery. BPC 157 is a really common one that a lot of people really like and seem to benefit from. And we'll be talking about that shortly as well. But the thing that I would look at with the back is, first of all, make sure that the alignment of the spine is correct. Make sure that it is in line, because a dysfunction to the spine will in turn absolutely cause a dysfunctional movement pattern of the muscles. If your spine is not properly aligned, you're going to have a dysfunctional movement pattern in the muscles. And so that's going to cause excess pain and undue stress and loading. You have to literally look at it like a vehicle, like a car. If I had my right wheel turned to the right and my left wheel just straight, and I just leave it that way, what's going to happen to I'm going to be replacing my tires all the time. And, we don't want to just be replacing things all the time. We can, and we have a great surgical group in our medical system that will happily replace parts, but we would rather prevent us from getting there. That's my role, really, is to prevent people from getting there and to maximize the amount of time and longevity that they get out of their joints. So improving the motion, improving the hydration of the discs and the joints themselves, certain exercises and movements. You can do traction. We can activate decompression. Acupuncture is actually a very beneficial one that we use a lot in back pain as well. And then back to our Chinese medicine techniques with scraping, gua sha, cupping, and acupuncture.
And from functional medicine perspective, magnesium and methylated B12 can address muscle spasms?
Yes, so magnesium is a really important one that we use for any sort of muscle spasm. A lot of people we're seeing are actually deficient in magnesium. And so by getting the appropriate amount of magnesium and by having methylated B vitamins, you want to make sure that it's methylated B vitamins, it can soothe and relax. So B vitamins play a big role neurologically. Magnesium malate is the one specific to muscles, but that's the one that you'll want to utilize if you're trying to treat a spasm itself. So magnesium malate and methylated B vitamins can be super helpful neurologically from the signal of what causes a spasm, and then also from the muscle itself as far as relaxing the actin and myosin fibers.
Sounds like posture is a big deal.
Absolutely. There's a whole host of things that go into making sure that joint is rehabbed properly. It's nutrition, it's alignment, it's making sure that you don't have a dysfunctional movement pattern and that you haven't overworked the agonist or the antagonist or the protagonist. So you really need to make sure that you have everything in proper alignment. And we can do that with chiropractic, with functional medicine, and with Chinese medicine that we offer here at Community Health and Wellness.
I believe the phone number is 435
657
3696.
Yeah, that was pretty good. I like the way we did it.
And the description is down below. Another episode of the Be Well Now podcast, top 5 sports injuries, integrative approaches to working on said injuries. It's usually not just something you can put in to chat or Google and get satisfactory answers to. You kind of need the individual approach, I feel like. I mean, to what extent can you just Google this versus it's really helpful to work with someone?
Well, you can Google anything or AI anything nowadays, and I think that will give you a good start. It'll give you a good maybe direction to head. But when you start working with somebody, with a professional that understands you and gets to learn about your body specifically, then you have a way more directed approach and it's way more personalized for you. That's what I would recommend. I would highly recommend you reach out to somebody, reach out to a professional near you that can specialize and tailor your rehab for your specific injuries and your dysfunctions.
And if you can do it on your own, more power to you.
Absolutely.
I imagine a lot of people try it first, as I would, before reaching out.
Well, and if you can do it on your own, I think that's fantastic, because one of the things that we encourage as chiropractic physicians and in physical therapy, we encourage the ownership of your own health. Like, we want you to do that, but one of the benefits of having a physical therapist, chiropractor, or a professional like that look at you and evaluate you is they can see your dysfunction. They see it all day long. They train it, they evaluate it, and they can look at you and say, okay, based on your movement pattern right now, I can see that there's a dysfunction here, and it looks like we're weak in this area, right? And so that's the benefit really of having somebody evaluate you that you're not going to get from AI, that you're not going to get from a Google search, is that you're not seeing the dysfunction that you're eliciting, right? Even though you may have been given this wonderful, plan, 3-month plan from AI or something. And it may be wonderful. I'm not saying it's not. I'm sure it's great, but it's not tailored to you.
That's a great point. Another episode of the Be Well Now podcast. Be well now, everybody.
Be well now. Namaste.
Namaste.